My name is Kavita Sao and I work at Counseling and Psychological Services at the University of Central Florida. I'm sitting here with our postdoc, Dr. Alyssa Steckler. Alyssa, can you introduce yourself?
Yeah, my name's Alyssa Steckler. I'm the postdoctoral fellow here at CAPS this year. I went to Nova Southeastern University for my PsyD in clinical psych, and now I'm here at CAPS.
Well, we're happy to have you. So today's World Mental Health Awareness Day, and this year's focus is on suicide prevention. So Alyssa and I are going to talk a little bit about that.
It sounds good. I think that, it can be really uncomfortable and scary to talk about suicide with our friends or family or another student, but it's really important that we are talking about it and having these conversations because it can be prevented the more that we look for warning signs and are able to talk with other people about how we're feeling.
Okay. I think it's out there that if you talk about it, that you're putting the idea in somebody's head.
Mm-hmm. And that's a common myth and misconception, actually. We know now that by talking about suicide, you are not making somebody more likely to complete suicide, and you're actually helping them get access to resources that can really help them.
Okay. What can we do here at UCF as a community to help people in distress?
Mm-hmm. I think one thing that we can do on the individual level is look out for some of those risk factors or warning signs. So if we notice that a friend or another student is isolating themselves or they're withdrawn, if they're not acting like their typical self, maybe they're posting things on social media that they don't normally post, or they seem hopeless, they won't talk about the future, plan for the future. I think that's usually some signs that they might be in distress, and to reach out to them and let them know the resources that we have on campus.
Okay. Well, that's all the time that we have. Thank you so much for sitting with us.
Thank you so much.